Okay, thank you so much for joining us today. And this morning we are with Esra Osman from Saudi. Esra, good morning, salam alaikum, and thank you so much for joining us from Saudi.
Good morning to you too. How are you? I'm very well, thank you. Thank you.
Wonderful. And Esra, you are a pharmacist. Could you please tell us a little bit about your career journey as a pharmacist?
Okay, I started into the University of Pharmacy at Sudan at 2016. Due to events happened in Sudan in the past years, I graduated not in 5 years, I graduated in 7 years. I graduated this current year, yes, but I've worked in like 4 pharmacies before. So yeah, it took me 7 years to graduate, not 5.
Wonderful. And
Yes.
if I understand why, well, right now you are working as a pharmacist in Sudan. Is that correct?
Yes, I was working till the previous April, but then there was a war and a current ongoing war still happening in Sudan for like 7 months. So all the institutions are destroyed and I had to escape from the country. So now I'm living at Saudi Arabia.
Okay, wonderful. And our next question is related to, pharmacist is playing a key role in the healthcare system as a medication expert. And I want to know in your practice how pharmacists can ensure safety and efficacy of medication for patients. Can you share your experience with us?
Yes. So from my point of view and from the work I did in Sudan, I worked in 4 pharmacies, and due to that the country is, let's say the economy is very low, the pharmacist is considered closely as a doctor. So people come to the pharmacist and we have to be aware of everything. We give the patient everything, how he take his medication, when to take his medication, when to stop his medication, when to refer to us or a doctor if anything happened or anything. So yeah, in my country, the pharmacists play a major role in the administration of medication. So yeah.
So we can say it's like the really first line, when someone is seeking for healthcare medication, they think first about pharmacy before going to any hospital. So that means you have a role as a medication expert. And sometimes if for example, you need to direct them to physician or to hospital, you can do that as well.
Yes, exactly. When the cases are major or need to be referred to a doctor, yes, that's it. But when it's, something you see in a community pharmacy all the time, so you can handle it. And the patient will be more relieved to talking to a pharmacist, than a doctor due to the expenses.
I see. So that means it's not easy for everyone to go directly to see the physician, and they prefer sometimes come directly to the pharmacy and stop by there.
Yes.
Okay, that's good to know. Sometimes in many developing countries is the same case. People go first to the pharmacy and just try to buy the medication there if they are able to get what they are looking for. And our next question is related to the collaboration. In the healthcare system, we have people with different qualifications, nurses, physicians, pharmacists. We all need to be able to work together. Could you a little bit tell us what is your experience in collaboration with other healthcare professionals?
Okay, so I worked in 2 pharmacies near a hospital. Due to some events in the hospital, not every medication is there, not everything is there. So the people would come to the pharmacy, the nearest pharmacy to the hospital. So yes, I have been in connection with the doctors there, with the nurses. And I also, when there's something is difficult or something I need to make sure of it, yes, I have connection with the hospital and with many colleagues, doctors, nurses, to ask him more about, you can get enough of knowledge.
So that means you have a lot of
Yes.
interaction between pharmacists,
Yes.
physician, nurses,
Yes.
and
And I have to admit that pharmacists need doctors, doctors need pharmacists. Working together is not that hard, it's not that difficult. So yeah, we need each other. It's
okay.
all for the sake of the patient.
Okay. And another question we have for you is, we are really interested by your experience and we want to know a little bit in your country, how pharmacists can keep themselves up to date, In medical
Yes.
field, we have more and more new knowledge coming all the time, and how
Yes.
pharmacists can keep themselves up to date.
Yes. So my graduation research was about the drug information resources. I went to the pharmacists and asked about how they keep up updated with the all the new things happening in the medication world. So all of them that said they have some websites, they would go. Some said they have some references at the pharmacy, at home, at phone. They use apps. So I went to 114 pharmacy, and all of them were using different types of websites, different types of references, but they all are updated. They're all excited about what's happening new in the medication world. They all want to know. It's something, let's say, personal, that they have to update themselves because there's no one will update them. There's no one will give them the information or new drugs coming up in Sudan. So we have to know what's happening in Sudan, what's happening in the other countries in the world. So yeah, they are updated. They are updating themselves, to be specific.
Okay, that's wonderful. So that means you did your thesis in Sudan, and then during this thesis, you did a survey, and if I understand well, it was 144 pharmacists.
Yes, I went to
and who complete
140.
this survey, and to be able to keep themselves up to date. What they used to do is to go more often online. Is that correct?
Yes, yes.
And in your mind, do you have some of the websites they used to check very often?
Yes, they went to medcams,
Medcams.com.
medalls.
Okay.
Yes.
Okay.
There is an app called Tibbi.
Okay.
There's a website called Al Wasila.
Okay.
It's all famous websites, in Sudan, we use them a lot.
Okay.
So yeah, it was the most common news ones.
That's wonderful. That's good to know.
Yes.
One thing everyone is talking about right now is artificial intelligence,
Yes.
and we would like to know your perspective about this tool and how you see the collaboration between this tool and pharmacists. Do you see that as an opportunity, as a threat? Do you see artificial intelligence taking the place of pharmacists, or they will be able to work together? What is your perspective on that?
Okay. So I did not see this in person. I did not witness anything in Sudan about artificial intelligence in this, but I've read articles about it. I've seen videos about it. So yes, it has both sides. It's a risk for the pharmacists that, it can do better, in regarding the information side. They have more information, they can store more information. But in the other hand, the artificial intelligence is not very able to deal with the patient, as we do. So because the patient is more comfortable speaking to a person or someone in real life, to tell them about your problems. And so yes, it has both sides. I can say it's a opportunity. I can say it's a threatening, but it has both sides, It has both sides.
So that means there are opportunity, but there are also threats. We have to think
Yes.
about carefully about artificial intelligence and how to use it
Yes.
in the pharmacy.
Yes.
Thank you so much. And any
Okay.
closing word?
Well, I was, and I'm still excited and happy for this event. I was not expecting for this to happen. Yes, I was so nervous. I was preparing myself for the past days, but now I lost it all and I start improvising the questions and the answers. And so, but I'm hoping that the world know the role of the pharmacist, that we are, and the physicians and all the nurses, we work together. We don't hate each other. We have to work together for the sake for the patient. And yes, I'm hoping that all the pharmacists in the world are doing well, and we are working better for a better community, for the people, for the patients, and so.